Hey, good morning, everyone. We have just opened the session for the Social Determinant of Health presentation of the 2021 eHealth Summit. I'm going to give it just a minute or two to let participants roll in, and then I'm going to get started. All right, we're about a minute in, and it looks like the participants are kind of slowing down as they roll in. So I'm going to go ahead and get it started. My name is Matt Loudon. I'm a program coordinator at the Kentucky Health Information Exchange. It is my pleasure to start off the Social Determinant of Health session for the 2021 eHealth Summit. And for an introduction today, we have a brief video from Pursue, our sponsor, Pursue Care.
Hi, my name is Nick Mercadante, CEO and founder. Pursue Care provides telehealth, addiction recovery, and mental health services. We bring low barrier, private, and evidence-based virtual care for opioids, alcohol, and other substance use disorders to patients through a convenient and easy-to-use phone app. Along with medication and therapy for substance use disorder, our multidisciplinary team also treats psychiatric needs of patients, and our pharmacy ships medications directly to their home. Every patient we treat works with a care coordinator who acts like a navigator in care and collaborates with partnering health resources in the Kentucky communities where we treat to ensure holistic mental and physical health outcomes for every patient. Pursue Care is proud to be a Joint Commission accredited treater, using measurement-based care to support improving clinical health outcomes for vulnerable and stigmatized populations across Kentucky. Our treatment is covered by insurance, and we offer low-cost self-pay plans for uninsured Kentuckians. We know that much of the time, patients first reach out for help within the community where they live. Sadly, fewer than 1 in 5 of those patients receive a referral to treatment that they need. It often takes weeks or even months to see a provider, and the programs are challenging to stick with because they are outside of the community or they don't offer evidence-based comprehensive medical care. That is why we work hard to integrate and collaborate with existing treatment resources in Kentucky communities. Places like hospital emergency departments, community health centers, primary care, and insurance plans. Pursue Care bridges a gap by bringing timely and engaging treatment to the patient right when they need it. Partners can connect with us to collaborate while a patient is on site, and then our treatment can continue at home. At Pursue Care, we believe that the ability to receive treatment should never be dictated by where a person lives. By working together, I believe that we can alter the course of holistic healthcare and outcomes for Kentucky families and communities struggling with the impact of substance use disorder. In the upcoming session, we will learn more about how KHIE is partnering with Connect Resources, the Commonwealth's web-based community resource portal, to link Kentuckians to appropriate resources to help mitigate the impact of social determinants of health on vulnerable populations in Kentucky. KHIE will leverage existing connections with healthcare organizations' electronic health records to exchange standardized data with Connect Resources. The data will provide healthcare organizations with actionable information to connect patients to relevant community resources. Now it's my pleasure to introduce Social Determinants of Health, Strategic Collaborations for Innovative Solutions, presented by Edward Loudon III, Project Coordinator for KHIE, and Tracy Williams, Program Manager for Connect.
Sorry to interrupt, Nat, but you're on mute.
Sorry about that. So like he said, my name's Nat Loudon. I'm a program coordinator with the Kentucky Health Information Exchange. And with me, I have Tracy Williams, an executive advisor for Connect Resources, the state-based community resource program. And it will be our pleasure to start with the Social Determinants of Health session today. First, let's talk a little bit about KHIE expanding our data footprint. So if you know anything about KHIE, you know we act as a hub of patient health information for the state. So as we continuously evolve and look out for new ways to innovate and serve Kentuckians, we thought that we would be an excellent organization to facilitate the exchange of social determinant of health data as well. Now, to do so, we are collaborating with Connect Resources, our Kentucky resource engine, to improve the holistic care coordination by linking residents to community partners and engaging in healthcare organizations. Now, social determinants of health in and of itself is kind of the idea that more than just a person's health care is derived than just clinical care, right? So a person's health can be derived from their physical environment, health behaviors such as smoking, eating, and then social and economical factors such as income, socioeconomic status, education, and things like that. So to help me show the collaboration between KHIE and Connect Resources, I have with me Tracy Williams, who will go from here. Thank you, Tracy.
Thank you so much for that. And thank you everyone for being here. My name is Tracy Williams. I'm with the Cabinet for Health and Family Services, and I am one of the program or project managers for Connect Resources. We really started looking at a way to build a system that helped people connect to help faster. And we've been working on this for a while. We are now live all across the state of Kentucky, but excited to move forward and tell you a little bit about Connect Resources. So we're going to go into a brief overview and share some information, and wanted to share, this is what our landing page looks like. And it's divided into, when you land here, you can see some different, we call these resource packages. And so if you are a resident or if you're a community organization, you can simply go to this website as a directory to be able to find the location for organizations and types of programs that exist near you. As a resident, you can come to this page, you can search by archetype or by resource package. And those are the different tiles that you see here on the screen. So the resource package, it may be, as an example, unemployment. Someone can be in that situation, so they're situational, and click on the unemployment or resource package. And whenever they're exploring the things available to them, they're going to see more than just maybe job placement type supports. They're going to be able to maybe find, maybe they need some other supports as it relates to rent assistance, because of course being unemployed affects your income. And so that may be something the system recommends to them, or maybe there's some food supports that this individual may need. So those are packaged together based on that situation. Also, whenever you're a resident and you're visiting, you can create a referral or a request for help, basically is what that is, being able to go in and connect directly with a community organization. Our community partners users actually start on this page as well. And this is where they begin their login and being able to use these tools that are available to them to be able to manage those incoming referrals that are made from other organizations or from residents, and eventually from providers as well. And then being able to also manage the referrals they're making. So this is a place where they can go and create that referral for an individual they're working with, and be able to use these tools to help the residents they work with along. And so with that, we wanted to talk a little bit about who our users are. So of course, I just talked about our residents. We have a strong activity with our residents. We have a lot of resident visitors to Connect Resources. They can go in, they can create referrals for themselves, as I mentioned. They also have access to be able to take that assessment. So there's an assessment that will help populate the social determinant of health criteria or designations, and they're able to go through that assessment themselves to be able to help them prioritize maybe where they need to look for resources. We mentioned the community partners. They're using this to manage their referral activity. They too can work with residents through the assessment process. But we also have some other important users. We do have our Department for Community-Based Services staff within their worker portal, where they're going in and helping individuals go through the application for state support programs, SNAP, TANF, email, or Medicaid, or child care. They're able to link over within that system to connect resources, because of course they're hearing individuals who maybe have additional needs. Maybe this individual needs some immediate supports from the community. They're able to connect with that. Or maybe they've worked with this individual and they're just outside of eligibility, but they still need help. So they're able to link over to connect resources in that situation as well. Of course, there's other state agency users. So this is a way for state agencies to also be able to look at those requesting their help. They also, many do work with individuals. And I'll give you an example, a career center that may be a state agency. They're able to sit with an individual, work through their immediate needs, but then also be able to use Connect resources to further assist. We also have a group of people called connectors. Connectors are people in our communities. They're represented every county in Kentucky. And these connectors help people through their health coverage applications. So they're working with individuals one-on-one to be able to help them through that process. And they also have a role within Connect Resources, because of course they too hear of those other needs to be able to address and be able to help them immediately connect with the organizations that would be able to provide those supports. And then lastly, I wanted to talk about our United Way partners. We were able to partner with United Way in building Connect and being able to work with community organizations to onboard and outreach to those organizations. We started with our United Way 211 database. And this partnership has really been beneficial for both United Way and for Connect Resources. But of course, they also do have the United Way 211, an informational resource support platform that residents can also use. But that is a partnership that has really helped us build out the directory for Connect Resources, and they've been fantastic partners in all of this. And so we wanted to also share, while we had everyone here, one of the benefits. So we started with a mission of bringing everyone together into a single platform. We wanted to really reduce barriers, but we also knew that we would be able to look at metrics along the way. What is the system telling us? What does this activity mean? So a couple of the metrics that we're able to share. So you can look here, starting first with the state graphic there. And this is a breakdown, and I don't know that it's the most up-to-date data, but this is user by location. So this is where the clicks are coming from as people are going in and looking for resources. So you can see, of course, our two largest counties or regions are seeing the most activity, but it's just a way to help us monitor, maybe are we seeing any service gaps, what are the outcomes in these areas, and really just being able to identify if there are additional needs. So that is one metric we do track. We also wanted to share a couple of metrics as far as the activity. We do have community partners who are onboarded, and that's 201 community organizations that have completed onboarding. What that means is they have completed the steps to be able to access some of the information we're sharing and being able to create those referrals on behalf of residents. So at this point, we're at 201. We also have about 1,500 assessments that have been completed. Those are both from residents as well as community partners. And then you can see the referral activity. So we've had 4,400 referrals have been created in the last 90 days. I will point out that the majority of our referrals right now are coming from our residents to our to our community organizations. And so those community organizations are the ones responsible for going in and closing those, and we're working closely with them to get that addressed. So a couple of other things we wanted to look at here is also what's the most viewed archetype. So being able to see, you know, where are people coming in, landing on that homepage, and what resource package is getting the most clicks. Unemployed I used as an example, and that it's definitely the one that is getting the most activity right now. But you can see our other top clicks where, you know, homeless, pregnant, substance use, elder care, employers, reentry, foster care, and veterans. So, you know, again, being able to have this information, one of the things that we wanted to kind of highlight is, you know, as residents are clicking that they're going to be able to see a more curated package as, say, the veterans, because it's getting the most activity. So, you know, as that adoption continues to expand throughout Kentucky of users, so those resource packages will start to get more helpful and more curated the more users we get. We also wanted to show the connecting with the recommended resources. So, you know, as more referrals are created and closed, then Connect Resources, you know, is able to recommend, you know, those more meaningful or more helpful resources. So you can see here on our chart where we've got the recommendations percent as well as all connected percent. So being able to use, again, this data in what we're offering and how we improve the system, and being able to really track what resources at what point of need are indicating the best outcomes. And that is where, as the system matures, we'll be able to really track that in a more meaningful way. And I mentioned onboarding, and I mentioned our community organizations who have onboarded, and we talked about the information they would be able to see. So we call this our one view screen. So if I am an onboarded community organization and I have gained consent from the individual, the resident that I'm working with, then I'm able to use this screen to see a real holistic look at what this resident situation is. So you can see here from the screen, I'm able to communicate with them. I can send them an email. I can add a note to their record. Maybe I can create a referral or start an assessment on their behalf. I can also see what their household composition is. So being able to look at who's in that household, what the age group is for those individuals, as well as the relationship. Just being able to have a better understanding of the situation for this resident. We also are able to display the enrolled program. So if this individual is in Medicaid, has a qualified health plan, as well as KHIE, then it's going to display that, and it's going to show what that start date is and when they're up for a renewal. You know, being able to share this information, making sure that, hey, there's an upcoming renewal date, if that's something the community partner notices, being able to keep people within coverage without gaps. But then also, if they're working with this individual and they realize they may or likely would be eligible for one of these programs, helping give them the direction to be able to go forward and enroll there. Along the bottom of our screen, we're able to share the assessments. What it's going to show is where the date, what the date was of that last assessment. You know, situations do change, so maybe that needs to be updated. And so that may prompt you to start that assessment, as we mentioned, and then also with the notes. So this is an important aspect too, because this is a way for community partners to be able to work together within the system, to be able to add a note that may be relevant to this resident for the next community partner that I'm referring them to be able to help them a little more in a little more meaningful way. And of course, I don't want to leave out the social determinants of health. You can see our chart here on the right-hand side. So when someone goes in and takes that assessment right now, it is indicating where they're at risk, maybe where they're vulnerable and where they have stability. So being able to display that quickly in a very easy to understand and view graph, being able to help that community organization or that community partner user be able to see that immediate situation, help inform them as they're helping determine, how they can help bring stability to some of these areas based on what their organization offers or what referrals they may be able to make based on that information. And we wanted to also share some of the system integration. So of course, I mentioned our United Way 211 partners. We did start with a data set from United Way to be able to populate as a directory information that includes the organizations, the contact information, location, hours of operation, that sort of information was provided to Connect Resources. I do want to point out that Connect Resources is not limited just to that data set. So if a community organization is not listed in Connect Resources, there's certainly steps they can take to be added and included. But that is the integration that was able to immediately populate the system. We also, as I mentioned, shared information about our eligibility, and that comes from our IEES system. That is our integrated eligibility and enrollment system. And we're able to bring in that information to share the household composition metrics that we shared, and then and then also that enrolled program information. So that's the integration that allows us to share that. And then of course, we want to talk about our KHIE integration. So this is sending we'll send social determinant of health information to Connect Resources so that the providers can be able to see that as well. So it'll be a shared integration where we're getting our information from our assessments, and then the system will also be integrating with KHIE to share the information in from providers as well. Within that one view screen, it would indicate which source that social determinant of health came from. Obviously in an effort to keep that updated, the most up-to-date information, but it's really a big, exciting thing to be able to move forward with this. And with that, I'm going to hand it back over. And I thank you for your time.
Thank you, Tracy. I think that really just highlights the robust services that Kentucky Resources can provide. And it really just it shows how exciting it is that this collaboration can truly benefit vulnerable Kentuckians and mitigate social determinants of health. So with that, I'm gonna jump back in. We'll start off with a little bit more on what social determinants of health really are, how it's affecting Kentucky, and then what KHIE and the collaboration between Connect Resources will mitigate those impacts. So first off, let's talk about just kind of the national perspective of why social determinants of health have become kind of this emerging topic. And it really revolves around this national trend where we're seeing a push away from fee-for-service towards value-based care, right? If you look at national statistics and you compare our country to other countries of similarly similarly economically developed countries, you see that our health outcomes don't match the way our expenditures do. We typically spend more money than most of the other economically developed countries, but we really don't see that reflected in our health outcomes. So what's kind of the deal there? And I think this is kind of, again, that push away from fee-for-service to that value-based care, where we move the health expenditures from the secondary and tertiary care more to the primary care. Now, with that comes a need for a more holistic approach and a more holistic data set for our patients. So with this, we want to focus on individual health outcomes and how social determinants of health are truly affecting our citizens, and then see how we can use those metrics and statistics to kind of fuel population health approaches. Now, on our right-hand side, you'll see a little scenario here, and this is going to keep this in mind. We'll use this throughout the presentation to kind of highlight how the KHIE project is actually working. So I'm going to just read this to you real quick, but this is Brandon, a Medicaid patient from Hyden, Kentucky, visiting an emergency department, which is the closest critical access hospital we have, because he lacks appropriate access to health services due to financial status and unavailability of needed health care facilities. Brandon is also experiencing housing instability. But let's just keep Brandon in the back of our minds as we go through this, and I'll come back to him and highlight how Kentucky is going to mitigate Brandon's social determinant of health impact. Now, again, we talked a little bit about the national perspective here, but I love this CDC map here. It's the percentage of our population that's currently living in poverty in 2018. And you can see here, especially in the southeastern quadrant here, that poverty is truly impacting a ton of states, particularly Kentucky. You can see that dark orange there on the right side that shows we have a heavy percentage of people living in poverty. Now that's important because income is typically an upstream driver of other social determinants of health. And you can see here on our right side, we kind of have a few of them listed here, a few of the upstream determinants listed, where education will typically lean into income, which will typically lean into where you are living, and the community around you and the geography can have major impacts on health. Now those upstream drivers kind of follow downstream and turn into downstream health effects like chronic disease, heart disease, diabetes, and cancer. So we're really trying to mitigate as many upstream determinants as we can so that we don't see the downstream negative impacts on our citizens. Okay, so how does that affect Kentucky, right? Well, if you look at any health outcomes, Kentucky doesn't rank among the best, right? We're typically in the 40s when it comes to things like heart disease, obesity, other clinical care. But if you can look on this left-hand side from our UDS map that we've borrowed, even self-reported health seems to be poor or just fair. And in the especially in the southeastern quadrant of Kentucky, you can see that it's near about as bad as it gets, with those dark green colors. It's a little bit better in the top left, but it shows an obvious need for what we're doing here. Now, in the national landscape of social determinants of health, there's I would say a lack of standardization, to put it lightly. So here at KHIE, we have developed and chosen our own social determinant of health domains that we think impact Kentuckians the most, and that we think if we track and try to mitigate these, that we will have the biggest impact on Kentuckians across the board. And we'll mention that a little later, but these are the 18 that we have chosen, and I'll show you how we do that on our dashboard as well. Now, just another two more UDS maps we have to kind of show the impact of social determinants of health on Kentuckians. Is here on our left-hand side, we have two upstream drivers, where we have our red colors as the population that is not employed, around 40%, which are national benchmarks here. And then our population that has less than a high school education, which is around the national benchmark is about 12%, and that's in the green. But notice our combined color here. For groups that have a population of at least 40% not employed and at least 12% having less than a high school education, you can see that it's affecting large pockets of Kentucky here, right? I mean, a majority of our state is actually covered in this dark burgundy color. So we can see that it's having a major impact, right? Now, these are both upstream drivers. But on our right side, we have a combined upstream to downstream effect, okay? So similar to that left side, we've got them broken down into two different colors, but look at the combined color here. For those that are at least 12% of the population has less than a high school education, at least 32% of adults are also considered obese. And we're in that same kind of picture here, where we've got large pockets of areas here that are experiencing both. So here we're seeing an upstream driver in education flow down into the downstream clinical metric of obesity. You can see how it kind of relates there. And now this also kind of relates to the clinical thought that comorbidities affect people more than just one or two clinical metrics, right? We typically see people are affected by multiple chronic diseases, so that we have to try and help solve multiple issues at once. And that's the same thing here. We typically see that when people are impacted by one social determinant, but they're impacted by multiple. So it's important to keep that in mind as we proceed. And that's what makes kind of this whole collaboration between the Connect resources and ourselves here at KHIE so exciting. We think we can have a major impact while we support the shift of Kentucky's healthcare landscape toward that value-based care as we continue to support health equity across the Commonwealth here. Okay, so how are we going to do that? How is KHIE going to work with Connect resources and get these people the help that they need? And really, it's on our side, on the KHIE side, we've got four main focuses. And the first one is evaluating social determinant of health data. So when a resident has a social determinant of health that is triggered through either an assessment like the Connect resources assessment that Tracy alluded to earlier, or maybe it comes through on an ICD code or some sort of claims data, we want to be able to pull that information and evaluate that as a social determinant of health code so that we know to display it somewhere else, right? Now, once we've evaluated that as a SDOH indicator, we want to standardize that data into an actionable format. Now, I say actionable because in our research before we kind of started the program, we saw that providers didn't really want the data if they didn't think they could do anything with it, right? Knowing that your patient has housing insecurity or instability isn't helpful if you can't send them to an appropriate resource to actually solve or mitigate that issue, right? So we want to standardize the data in an actionable format so that when the provider, a case manager, whomever uses the service, they can see exactly what's going on with that patient in their social determinant of health that are impacting them, and then be able to do something with that. Now, once we've standardized it, we will display that to them so that they can see those standardized codes. And then we want to provide that link to Connect resources to refer them over, right? So that's the actionable piece there. We've standardized it into an easy recognizable format, and then we provide a link over to Tracy and her team so that they can get those people connected. I won't go over the Connect resources because Tracy did such a phenomenal job, and she will be available during one of the network events too if you'd like to speak with her, ask her any more questions on it. But I'm gonna go ahead and move forward here. Okay, so I talked about how important standardizing this data is, right? So how do we actually do that? Well, we typically look and we're actually leveraging already existent data feeds. All right, we'll receive ADTs and CCDs that have all this information on them. We have access to every Medicaid claim that comes through Kentucky. So how do we use that to get our data out of there? And we do that by looking at the codes that are within them. So there are two different coding sets that we have already implemented, and there are more on the way, but the two main ones we'll look at today are the linked social determinant of health codes, which started as the 80216-5 codes, but have evolved into a few different areas to include a few more domains. And then the ICD-10Z codes, which have been around for a few years as well, but they're pretty standard, and we're really excited about those as we have seen that those have flowed through the system for the past few years, and then we have seen an uptick in the utilization of those codes. So we're excited there. But how do I get it? Okay, so we have two different code sets. How do I get that to display it so that a provider or case manager knows what to do with it, right? Well, we take those codes and we act almost as a funnel. And depending on what the code is, we will actually funnel that as either a critical, important, or stable, and then we will display it as our social determinant of health indicator in our domain display, right? So for an example, if we have an ICD-10Z code, the Z codes we treat as dichotomous, basically questions. You either see them and they're present, or you don't see them and they're not there, right? So it's either A or B. But if we get, say, a Z59.1 inadequate housing code, we get that in and we see, okay, it's present, and we say inadequate housing. Okay, well, that's not nearly as bad as maybe homelessness. So it's not critical, but that person probably needs some help, right? So we classify that as an important, and then display that in our information on our ePartner viewer. Now we also send that information to the Connect resources so that they can display it on, I believe they called it the OneView dashboard, right? Now for our loink codes, they're similar, but because it's not dichotomous, it's a little different. We'll have the code come in, but typically they have almost like a Likert scale where you'll have different kind of different levels of severity for each thing. So that makes it a little easier for the severity of critical, important, and stable. And it still flows through to the Connect resources when we've done that. So say we have a loink code that comes in and it says, how do you pay for the very basics like food, housing, and utilities, right? Well, we will take that, and depending on their answer, we will actually standardize it and then display that within the upstream determinant, right? Because that one kind of hits on a few of our domains. So we will display that in our upstream determinant of income, as income typically affects the other three that were mentioned, right? Now, along that same lines, we have the codes that are flowing into Connect resources, but they have their assessment that Tracy talked about earlier, that it will be flowing into our system, right? So we have a bi-directional exchange of social determinant of health data that has all been standardized to the same critical, important, and stable scale. I think that's all for this one. So how do we display that, right? If you're at all familiar with our ePartner viewer, you know it's robust. It has a ton of different features. Maybe you've sat with our good friend Charlize, and she's taking you through some of these features, but we're going to actually add a new portlet view here that shows kind of the social determinants of health that are impacting health. Now we've got again, if you're familiar with ePartner viewer, you've seen old Bobby Brady before. He struggles sometimes getting the help he needs. You can see he's been pecked by a chicken 5 times in 5 days. That's not great. So he's got some social determinants of health here affecting him as well. And you can see this snapshot view here. We will display a few codes that we've received and display them here so that you have a quick view, and you can look here at the date to see if it's actually been relevant or near the current date. But when you click over here on the panel, you will see our full page here. Now on our left side, we have more of a macro view, and on the right side, we have more of a micro view of determinants that are impacting health. So this left side is our domain indicator view and gives you a full snapshot of all of our domains and those determinants that are impacting health. So you can see here that we have adult education, employment, income, etc., but they have our indicator colors here, right? So you should be able to read straight down and say, okay, well, we're having trouble with family involvement, having trouble with disabilities, so we need to refer them out here somewhere, right? But like community involvement's green, so we don't have to worry about that one. Now, if we don't have any data available here, we will display it just as a grayed out dot, basically, so that you don't really have to worry about it or engage. Now, say you were over here and said, let's say Bobby's income over here is yellow, but I don't think that, I've never heard him say anything about that, right? Well, you can come over here to our micro view and then go through each individual code that has been sent to us and say, well, okay, this person did actually answer somewhat bad on our loink code here. So yes, that makes sense that the income reflects that yellow because it's somewhat bad, right? If we would have seen terribly bad or whatever the most severe answer here would have been, we would have seen a red dot over here on the income. Now with this, if we have more than one come through, so we have, like I mentioned, we have 3 different resource sources, the ICD, Loink, and the Connect. We will display the most recent one with the Connect resource assessment being our kind of our anchor data point there. So if anything contradicts the Connect resources, we display what they have. Now, once we have determined that we want this, we want Bobby to kind of receive some help here, we'll come over here to our right-hand side to our Connect Resources single sign-on, and that's what we will use to actually refer out. So we'll click that, it'll take us to our single sign-on to Tracy's page over there, and then we can help refer people out in that way. I want to do it on time. Ooh, I better hurry up a little bit. Okay. So how do we actually use this to create their referral? Like I just said, we kind of we use that last little, we use our last little link up here, a little small, hope you can see it on your screen. But when you click that, it's going to take us back over here where they can create that referral here. Okay, now it'll give you another view so that you can see a little bit more of the social determinant of health information. But again, that's a bi-directional exchange. So what they are displaying should be the same as what we are displaying on the KHIE side. Okay, so I told you to keep Brandon in mind, and this is going to be how we kind of wrap it up here. So we have evaluated that Brandon has gone into the critical access hospital ED with a few different issues, right? So while he's there, his physician, Dr. Green, evaluates Brandon as experiencing housing instability, extreme poverty, and lack of primary care health care facilities. Now, once Dr. Green kind of evaluates him at this, she will write that down into her system. It will be coded on the back end. We're going to assume that Brandon's a Medicaid patient, and then we will see that claim data, and that claim data will come through KHIE, right? Now, those evaluations will trigger those multiple social determinant of health codes, and then our in-house standardization tool that I alluded to earlier will assign those codes a domain indicator color. Now, once we have standardized and displayed, or once we have standardized the data, we will display the data, and the case manager, Casey, sees Brandon's real-time social determinant of health domain indicators in Connect Resources and in KHIE's ePartner Viewer. So the case manager has picked up Brandon's case, has gone to our social determinant of health portlet view, can see the domains that are now impacting his health, can see the individual determinants that are now impacting health, and she creates a referral using our single sign-on function to Connect Resources. Now, once Casey has created that referral, it's kind of over again in that Connect Resources side. But that has closed our loop on the KHIE side of evaluating the social determinant of health data, standardizing the data, displaying the data, and then giving a platform to refer that data out. So kind of the impact of the collaboration that we're hoping to see, and that we've seen in the national literature that evidence kind of suggests, is that we improve health outcomes through population health, and we cut down on healthcare cost inefficiencies. Now, we chose the emergency department example specifically because we see in healthcare that tends to be an overutilized area of health that we think we can have a major impact in cost savings. So that was a reason that we kind of used that. Now, we also want to standardize this data as much as possible so that providers and case managers also have that actionable data. Again, that was a huge focal point. We didn't want to just display data that no one could do anything with. We wanted them to be able to see meaningful data, make actionable decisions, and then have actual health outcomes improve without increasing the number of clicks tenfold, right? So we want to utilize community resources and increase patient engagement with this. We think that once the patients kind of realize that so much of health is derived from things that other than clinical care, we think we'll have a huge patient engagement uptick, and we'll see that flow into healthier outcomes and healthier people in our state. Now, with that, I don't think we actually have a question and answer session today. We do have a networking event. Let me pull up that information real quick, though, just before I butcher it. So we do have an exhibit networking lounge from 12 to 12:55. So please, when you're done with this, flow into that. Now, you can also engage and win prizes through our leaderboard, so be sure to check that. And I really appreciate your all's time today as we discuss the social determinant of health. Nothing left on my side. Tracy, do you have anything left?
Nothing left on my side either. I think that this is exciting, and any other details, certainly reach out and let us know. And we thank you all.
Thank you all for attending, and we hope we were able to teach you something today, and we hope we were able to get you excited about our collaboration. Thank you all.